Ladies, we all know the annual checkup with a gynecologist can be uncomfortable, but I hope you will join me in honoring Gynecologic Cancer Awareness Month by learning more about the types of gynecologic cancers and their symptoms. I'm Catherine. Welcome to the Inspired Vitality Show. Gynecologic cancers are the uncontrolled growth and spread of abnormal cells originating in the female reproductive organs. There are 5 main types affecting the cervix, ovaries, uterus, vagina, and vulva. Cervical Cancer Awareness Month is observed in January, while September is also Ovarian Cancer Awareness Month. I'm still going to include these both in this video, but be sure to check out my video specifically for cervical cancer, which is going to be linked to in the video description, and watch for a video coming up soon about specifically ovarian cancer. Almost all cervical cancers and some cancers of the vagina and vulva are caused by a virus known as HPV. According to the Foundation for Women's Cancer, every 5 minutes someone will be diagnosed with one of these cancers, and over 33,000 will die from a gynecologic cancer this year. That's unacceptable. Screenings conducted regularly can result in the detection of certain types of gynecologic cancers in their earlier stages when treatment is more likely to be successful. Gynecologic cancers are treated by using one or more of the following: surgery, chemo, and radiation. The treatment depends on the type and stage of the cancer. Each gynecologic cancer has different signs and symptoms as well as different risk factors. However, symptoms of gynecologic cancer in a broad sense include pelvic pain or pressure that doesn't go away and you don't know why, feeling too full too fast even when you eat just a little bit, unusual vaginal bleeding like having longer or heavier periods than what's normal to you, or bleeding after you've gone through menopause. If you have any of these symptoms for more than a couple of weeks, please talk with a healthcare provider. Don't let fear stop you from making an appointment. Waiting will not necessarily improve the outcome. Now we're going to go a little bit deeper into each of the 5 main types. Cervical cancer symptoms include abnormal vaginal discharge or bleeding, bleeding after vaginal sex, vaginal odor, and pelvic or abdominal pain. Most cases of cervical cancer are now preventable. It is recommended to get the HPV vaccine before becoming sexually active and having your children vaccinated at ages 11 to 12. The best way to find cervical cancer early is to have regular Pap tests and HPV tests between the ages of 21 and 65 at intervals recommended by your healthcare provider. There is currently no good screening for ovarian cancer. See a gynecologist if you experience any of the symptoms for more than a few weeks, including bloating, urinary symptoms, as in urgency or frequency, pelvic or abdominal pain, difficulty eating or feeling full quickly. Ovarian cancer early detection tips include scheduling regular checkups, including pelvic exams, knowing your family history, and asking your doctor about genetic testing. Additional tests may be offered to screen those with a high risk of ovarian cancer due to an inherited genetic syndrome such as Lynch syndrome, BRCA gene mutations, or a strong family history of breast and ovarian cancer. Endometrial cancer, also known as uterine cancer, is the most common gynecologic cancer. Getting to and staying at a healthy weight is one way to lower your risk of endometrial cancer. Early detection improves the chances endometrial cancer will be treated successfully. See a gynecologist if you experience unusual vaginal bleeding, spotting, or discharge. Women who have reached menopause are strongly encouraged to report any vaginal bleeding, spotting, or discharge to their doctor. Signs of vaginal cancer include unusual vaginal bleeding, bleeding after vaginal sex, pain, problems with urination or bowel movements, a watery discharge, or a lump or mass in the vagina. Vaginal cancer is associated with HPV, and the HPV vaccine can be used to prevent HPV infection. Routine wellness visits and cervical cancer screenings can sometimes find early invasive vaginal cancer. Signs of vulvar cancer or precancer include chronic itching, abnormal bleeding or discharge, skin color changes, and a bump or lump with wart-like or raw surfaces. There is no standard screening for vulvar cancer, so knowing what to look for can help with early detection. Thank you to the Foundation for Women's Cancer for being a great resource for Gynecologic Cancer Awareness Month. They have a toolkit with all of this information that you can download on their website, and I'm going to link to that in the video description. Now that you are armed with symptoms to watch out for, listen to your body and talk to your doctor about anything that concerns you and persists for 2 or more weeks. Please be proactive in caring for yourself. If this has been helpful, give this video a like and share it with other women in your life. See you soon.